Patient will call in for an appointment. My staff would find out if they have vision insurance or not. We try to get as much information ahead of time. We have a website patients can download history forms, or we can fax it or mail it to them.
We see all age ranges, anywhere from age 5 all the way up to 95. So it's great to have that range of patients.
Hello. Welcome. Do you have an appointment with us today?
Yes, I do.
Okay, let me go ahead and give you our new patient forms for you to fill out. Okay, since you are a new patient, this here is going to be a recall card we'll send to you next year for your annual exam. If you can go ahead and fill out your first and last name, home address here. We'll send this to you next year for your annual eye exam. The first sheet is going to be your medical history form. You can fill that out front and back. The second one is going to be a sheet in regarding our 2 procedures that we do have done. The first procedure is going to be the dilation. The doctor does a thorough exam of the back of the eye to check for any eye health diseases. This section here is called the digital fundus photography. This one is not included with the insurance. The next sheet that we have is our dry eye survey and allergy survey. If you can just briefly go through those questions and answer those for me. And the last one is our privacy policy. If you can just sign and date that one as well for me. And also we do ask for your medical insurance card. What we do is keep a copy of it on hand in case the doctor finds any eye health diseases as glaucoma or cataracts. The doctors can actually help check for that. So we usually do that underneath your medical insurance. So if you can fill that out for me, we'll get you set up.
All right, so go ahead and take a seat right here. This is the fundus photography. I will take the picture of the back of the eye, which is called the retina. Go ahead and place your chin right over here. Okay, this image allows the doctor to detect any eye disease that may cause loss of central visions. All right, so you should be seeing an orange flashing light. Okay, now you should be seeing a green light off to the side. Let me know if you see it. Okay, so we'll go ahead and take a picture. All right, there it is. The doctor will go over this in the exam room.
The glaucoma is a disease where you lose your peripheral vision little by little, and it happens so slow that most people don't realize until it's kind of too late. So this is like an early diagnosis testing, because most people can't test their peripheral vision. As well as it can detect brain tumors. If a patient has beginnings of a stroke pattern, it will show up on there as well.
All right, Lance, go ahead and have a seat here. So the first test that we're going to perform today is called a visual fill, and it tests for any deficiencies in your central or side vision, okay? All right, go ahead and put your forehead all the way forward and place your hand on the mouse. You will see a small black square in the middle. Do you see a black square in the middle there? Yes. I want you to keep your eyes focused at that black square, okay? And for the next few minutes, you will see a series of alternating flashing gray lights. Each time you see the light, you're going to press the button for me, okay? So I'll let you know when you can start. Go ahead and start. Okay, terrific. Okay, and the doctor will go over the results with you in the exam room, okay?
The autorefractor, what that does is it gives us a starting point. Let's say a patient is brand new to our office and does not currently wear glasses or forgot to bring their glasses. What that basically tells us is it tells us where to start the exam for the glasses.
Okay, Lance, so the second test that we're going to perform today is called the autorefraction, and it determines the prescription. It also gives the doctor the shape and curvature of your cornea, okay? So go ahead and place your chin on the chin rest for me and forehead all the way forward. Do you see a barn in the middle there? Yeah. Okay, very good. Okay, very good. All right, and the doctor, again, will go over this with you in the exam room, okay?
It's kind of like a colored MRI. Actually shows not only what's on top of the retina, but actually layers underneath.
Go ahead and have a seat for me there. Okay, so what we're gonna do here, we're gonna check the retina. So all you're gonna do here is just place your chin here. Make sure your forehead is touching here. Okay, go ahead and focus straight for me. Try not to blink. I'm gonna take a couple scans. That one came out good. Okay, good job. We're all set.
The most important part is the dilated exam, which is not really convenient to a lot of people, but it is probably the most important test that I do.
Normally when you shine light at the pupil gets real small. When that happens, then everything in the back of the eye is hard to see. So what we do is we use eye drops to help to dilate the pupil, meaning making it large so that way when we shine light at it, it does not constrict or get smaller.
I put drops in the eye, make the pupil larger than normal, and take a look at the back of the eye and then look at what's called the optic nerve. Because the subtle changes in what's the optic nerve, like 55% of the cases of glaucoma can be detected by how the optic nerve looks like.
That way we can see the whole entire back of the eye to see if there's any problems. There's a whole bunch of things that we could see, such as diabetes or high blood pressure.
The best analogy is if you're looking through a peephole of a door, it's kind of how it looks through an undilated pupil. And when I dilate the pupil, it's like opening up the door and looking inside.
We'll see you at your next appointment.